for those who are using this. Let's take the issue of prevention. People want to prevent contracting Omicron. They go out to church or a congregate setting, they go home. What are you seeing being done in the community?
Well, I think if you're out in a group environment, when you return home from being in any kind of group setting, it's probably a good idea to do some type of a oral rinse and nasal spray. And that can be done easily with povidone iodine, where you would just take a shot glass of water. You would put a half teaspoon of 10% povidone iodine, mix it together, use it as a gargle for about 30 seconds. You could also do a nasal spray, which would be the same dilution, and you would just squirt 2 sprays in each nostril, and then make sure you either allow it to flow back out. You don't want to swallow it. And doing that a couple of times a day, particularly if you've been exposed or in a large group, you would not want to do it long term. And if you have any kind of thyroid dysfunction, or if you're pregnant or have any kind of allergy to iodine. And then as an alternative to that, if you do have any allergy to iodine or pregnant, you could also use a dilute hydrogen peroxide solution. And that would be, there's 2 strengths. The oral strength is a little bit stronger, it's 1%, and it would be an ounce of water with 3 teaspoons of 3% hydrogen peroxide. Same thing, gargle with that for about 30 seconds, a couple of times a day. The nasal solution is more dilute. It is a 0.3% solution. And that would be, again, it would be a 1.5 ounce or a shot glass amount of water with 3/4 teaspoon of 3% hydrogen peroxide. And same thing in a nasal spray bottle. You would spray 2 sprays into each nostril a couple times a day.
So with those, Claire, my understanding is you can add a pinch of salt to make it a little bit more physiologic. And if you're just going to use a shot glass, you can just use single use water out of the tap. But if you're going to make a bigger solution you're going to use for days, to use either sterile saline or use sterile water. Claire, I've done this myself. And so I have a couple of tips. I've made the solution, and I use a pump spray bottle that I ordered on Amazon. They're very cheap. It was like $2. I was able to get a couple of them. And they're just brown little glass bottles that have a white pumper on it. And I've learned that I have to stand over the sink, kind of pump it several times up into my nasal cavity. Then I sniff it back, and then I spit it out. So I get it all the way back to the soft palate, and I spit it out. It actually does clean out the sinuses, which is really good. And then you've gotten it way back. And that this can be done every 4 hours during the acute illness that was done in the Chowdhury trial. It's very hard to do it every 4 hours. Honestly, you kind of forget about it, but at least several times a day. And then what I do is that this remainder of what's in the shot glass, you can easily gargle with it. Another gargle solution you can use is regular Listerine or regular Scope that has some antiviral activity. So if anything we've learned is to do a better job taking care of sinusitis, general viral upper respiratory tract infections. This should work for them as well. I'm a little disappointed as an internist and a cardiologist that I've learned about this pretty late in life. We learned about this pivotal clinical trial in 2021. So this is wonderful. We've reviewed on the McCullough report that this results in a rapid clearance of the PCR, turning it negative, as well as reduces the chances of hospitalization and death. So Claire, this has been a wonderful review of your work in your community and how you've been really an exemplary leader on encouraging others to get involved in early treatment of COVID-19. Do you have any final words for the McCullough report?
I think that this will benefit a lot of people right now during Omicron. I hope that it will be something that will give people a peace of mind knowing they've got a plan. If they can have a plan in place and they were to get COVID, I think it will be an easier process. But this is such an easy protocol for patients. Anyone can do it. These ingredients are readily available. And it seems to really be making an impact for people that are getting this virus.
Well, I'll let that be the last word. Thank you so much for joining us on the McCullough Report.